Welcome back. Wonderful to have you all along for the ride and for our next company that is presenting, Respiri. It's an e-health SaaS, a software as a service company supporting respiratory health management. Its world-class technology detects wheeze, which is a symptom that's very typical of asthma. Many people would know that themselves. A COPD as well, and respiratory disease. So it's to provide an objective measure of airway limitation, and that's what its technology does. WHEEZO is Respiri's innovative technology. So it's an e-health app that's combined with a simple, easy to use handheld device. WHEEZO is the first smart device to help improve asthma management by monitoring wheeze and documenting symptoms, signs, triggers, weather conditions, and medication use, and how that all impacts that wheeze. The asthma management platform also facilitates the sharing of data with caregivers, physicians, and other healthcare professionals. So you can ask questions throughout the event, and we will get to them at the end of the presentation. But we do welcome Respiri CEO and Managing Director, Maren Mikkel, to present more on the company for you.
Thank you, Nadine, and good afternoon, everybody. Thank you very much for joining us today, and I hope to be able to provide you with an overview of our strategy, the achievements to date, and also the roadmap moving forward for the organisation, both here in Australia and our international aspirations. But for those of you who don't know the organisation, as Nadine put it out, we are an organisation that really focuses on medical device and SaaS as our revenue sources in the area of respiratory medicine. Our primary channels in Australia are pharmacy and online. We've managed to get all major regulatory jurisdiction approvals, so FDA, CE and TGA. As of the end of June, we had about $10 million left in the bank. And important to note that the directors of the company do put their hands where their mouths are and have invested in the organisation ourselves. So it's important to note that we have skin in the game, so to speak. To our friends in Sydney, Southeast Queensland, Adelaide, and earlier Melbourne, we all know that this has been a rather interesting time for the world and certainly for Australia. And in these difficult times, I thought it important to reflect on everything that's been achieved by the Respiri team over the last 18 months. It's important to note that last March, we achieved our FDA approval. We are now contracted with about 1,700 pharmacies with all major banner groups contracted to supply of WHEEZO through a simpler global agreement. We got TGA and CE a while ago. We're targeting our online program for the APA partnership in Q3 this quarter. We've filed patents for extensions of the WHEEZO itself and also the app. We have started selling WHEEZO into the pharmacy channel, and importantly, we've managed to achieve our goal of $50 COGS. That's cost of goods for the WHEEZO device, remembering, of course, that the device originally cost almost $800 to manufacture. And we've reorganized the organization to take advantage of both the SaaS and the medical device revenue streams, and importantly, puts us in good stead for the launch in the US. Importantly, we are working with respiratory physicians to provide patients with a product as a service and telehealth to better help them manage their asthma by providing these physicians with the transparency that they need to get from the real world where the problems for asthma patients really happen. We all know, and I've spoken to this many times, that asthma is very suboptimally managed. There's almost 2.7 million patients with asthma in Australia. Even in this great country of ours, still 400 people die of asthma every year. It costs the economy almost $25 billion. Crucially, patients that think they're being controlled are not actually being controlled. And this is not what I think. There have been numerous studies that have demonstrated that what a patient thinks is well-controlled asthma is in fact not well-controlled at all. And there are certainly difficulties in being able to manage asthma in the young and the elderly. So this is where we come to the fore. Part of the problem of the current situation with suboptimally managed asthma is that it's one of the few diseases that's being treated at the moment. It's the third largest to afflict the human race, where there is no physiological parameter that a GP or doctor, I should say, actually uses to diagnose the disease. It's actually based on symptomology. And the doctor relies on subjectivity, that is patient recall, and also patient memory. So they're really relying on what's been proven in many epidemiological studies as not being the ideal way of gaining information about what's happening to a patient from the real world. And importantly, almost more than a quarter of patients, adult patients, have not seen their GP about their asthma in the last 12 months. So there's a fundamental disconnect between objectivity and the disease state itself, because at the moment, best practice are questionnaires, the asthma control questionnaire, the asthma control test. So these are the things that doctors use today to try and understand how severe the asthma is that they're dealing with their patients. Importantly, GINA, that is the Global Initiative for Asthma, this year updated its guidelines. And it should be noted that patient self-management is a key part of what it is they're trying to drive as an organisation. There are 6 pillars that they are really pushing, and we have developed our devices and also our apps to take full advantage of these devices and support them. So asthma information, inhaler skills, adherence, a written action plan, of course, self-monitoring and or peak flow, and a regular medical review. Now, in that regard, WHEEZO provides information around weather, pollen, air quality, disease information and education are currently in development. Our Connect Care nursing coaching team and online videos provide help when it comes to inhaler skills. Self-reporting is also pretty important when it comes to being able to determine whether or not the patients are taking their medication. But as I've said in the past, we are broadening our platform to include a broader portal that will allow us to speak with other technologies that will provide us with the information in this space. We have, as you know, the digitized asthma management plan that's been developed by the patient's doctors. That's in the app. And importantly, when it comes to self-monitoring, WHEEZO, of course, records the patient's breathing, shares that information with the doctor and the carer team. And we also are incorporating the clinically proven asthma control tests into our app and also self-reporting of symptoms. And importantly, because it's all clouded, this information is available to the healthcare professionals looking after the patient, which allows for a more objective medical review of what's going on with that patient. WHEEZO itself, many of you have seen this, is a very simple device to use. You place it on your trachea like so and breathe normally for 30 seconds. It's Bluetooth to your phone where the recording of the breathing is stored, and the algorithm analyzes the breathing for wheeze rate. And that basically becomes a piece of information that's very valuable to the doctors, because what it does is it allows the doctor, at the very worst, to listen to what the patient's breathing was like from the real world when there may or may not have been problems. And the wheeze algorithm allows us to provide the doctor with an objective review of what their wheeze rate is. And as was said by Nadine earlier, wheeze is one of the key symptoms that doctors talk to and find out about when they talk to their patients. As I said, on the app, we have the ability, as I've already said, to analyze the breath sounds and for the presence of wheeze. And importantly, the doctor can listen to these in real time if they want to, and after the fact. We also report on air quality, triggers and symptoms and medication usage. And importantly, as I said, the uploading of the asthma management plan that's pulled together by the physician brings that plan to life on a day-to-day basis, rather than it being written on a piece of paper and ending up in the top drawer. Importantly, that information, as I've said, and that longitudinal snapshot of the patient is shared with the physician and also with other healthcare professionals and the carer team. So what this does is it eliminates, or minimizes, I should say, the need for the physician to rely on patient recall and memory and self-assessment. These are objective measures, whether that be breathing, wheeze, the climate at the time, air quality, medication usage. They are objective rather than needing to rely on a patient's recall. So it's a lot better at being able to provide doctors with what's actually happening from the real world, to questions they would have asked patients anyway. How does it work? The recording is basically the basis for the algorithm. So as you can see from this particular graph, many of you have seen this before, we have a spectrogram here where we can very clearly see a wheeze, another wheeze, another wheeze. This isn't an opinion. This is really a spectrographic representation of the wheeze. So it really doesn't matter what anyone thinks they may or may not have heard with a stethoscope or otherwise. The wheeze is very clearly seen in the spectrographic representation here. So as I said, it provides for a very objective way of looking at what wheeze looks like and eliminating any errors that may occur with stethoscopic evaluation. So the device itself is fairly straightforward. It has a recording microphone in the front that placed on the trachea and a noise cancellation microphone on the back to get rid of extraneous noise. As I said earlier in the piece, we did manage to secure FDA approval as an OTC Class 2 device in March this year. And this really does provide us with a very broad set of opportunities that we can explore when we come to launching in the US. The Class 2 device allows us to pursue reimbursement possibilities. Reimbursement possibilities in the remote patient monitoring CPT codes, which require a physician prescription. It also allows us to explore the pharmacy channel and retail channel. So that's not to say that we will, but it opens up that opportunity for us as it does the online opportunities with Amazon and the like. Importantly from us, the indication for the device in the US is agnostic, but our focus remains on asthma where the big opportunity is. There's almost 28 million patients with asthma in the US and 3.3 million of those are kids. Importantly to note, the regulation and approval applies to everyone over the age of 2 years. So it does open up a whole heap of opportunities, and that provides us with options, which is always a good place to be. We are in advanced discussions with quite a number of remote patient monitoring providers. These are people and organizations that have relationships with physicians in the US, and basically they provide a shopping list, if you will, of medical devices that the physician can use to claim against a number of codes, remote patient monitoring codes included. And there are specific organizations that really do focus on respiratory medicine in this space. And as I said, we are certainly in advanced discussions with quite a number of these. And importantly, from our perspectives, the opportunity in the US is quite substantial in that a US patient will generate up to 5 times the annual revenue that an Australian patient will, and with little or no out-of-pocket expense, unlike Australia where it's all out of pocket. So there's a significant amount of money that the physician can make. And the interesting thing about the US marketplace, it's one of the only reimbursed markets in the world where it's the physician that gets financially incentivized to provide medical devices that provide remote patient monitoring options to the patient, not the billers. For instance, in the UK, it's the providers of devices that get paid these cash. In the US, it's the doctor, which makes it rather unique. And there is an ongoing annuity stream on a month-to-month basis. So a doctor can make up to $1,350 per annum. And of that, we estimate that we can charge between $360 and $480 per annum for providing the services that doctor needs to be able to provide the remote patient monitoring for patients with respiratory conditions. Moving forward, we have a comprehensive research program and other programs in place. We recently submitted a wheeze algorithm expert analysis to the European Respiratory Society, and that was just yesterday approved, and it'll be presented at the Barcelona conference virtually on the 7th of September, by our investigators to their peers. So that's a pretty exciting thing that we found out about yesterday. We're in the final processes of finalizing the protocols for a study that will compare wheeze rate, our algorithm, versus lung function in terms of spirometry. So that's moving ahead quite nicely. And again, that will be work that we'll be doing in the UK. As I've said, we have a pilot program underway right now with respiratory physicians that will use the WHEEZO to monitor their patients remotely, and with telehealth and the Connect Care nursing team, provide the support that they need to be better equipped to manage their asthma and take control of their own condition. We're also looking at integrating other pieces of data into our app to provide a more comprehensive solution, a more comprehensive digital solution to patients with respiratory disorders and also their carer team, including their healthcare professionals. The asthma control test is being incorporated as I speak. I've spoken for the need to incorporate smart inhalers, and there's many of these things available today. And as I said, I want to be technology agnostic. So we need to be able to provide physicians and patients with a way of objectively measuring as much as we possibly can about what's happening to them in the real world. We're also looking at incorporating peak flow meters to round out the information that we're capturing on a longitudinal basis so that physicians and patients can get a much better understanding of what their profiles look like, what high-risk days look like, and what they need to do to avoid attacks and exacerbations from happening. As I said, we're up to around 1,700 pharmacies now that are onboarded, and more are scheduled as we move forward. So virtually all major brands are contracted to work with Respiri through our partnership with CIPLA, and we are rolling that out across them as we speak. As I said, things are a little difficult with the way that lockdowns are happening and what the future holds. The vaccination program now incorporating pharmacies as well has, I guess, complicated things a little bit. That's not to say that we're not rolling it out, but there are other priorities that we compete with. So it's important to note that that's what we're doing at the moment. Important to note, I just thought I'd share this again to make sure that people understand the sales cycle into pharmacy. So from the time that WHEEZO is produced by our manufacturing partner, Entech, it'll take between 3 and 4 months to go through the channel process. 30 days for CIPLA to receive it. CIPLA then sells to pharmaceutical wholesalers who will hold the stock from between 15 and 30 days themselves. Individual pharmacies will place an order and that'll get put into their stores, and then it'll take some time for those stores to actually sell the devices to their patients as they come in for other businesses and also through work that we're doing. And then those orders will be repeated again. So I just wanted to make sure that people understand that there is a process, and the process starts with manufacturing and ends with the purchase with a patient buying the device and then activating that device and taking advantage of the SaaS programs. And that's between 3 and 4 months from day dot. So I'm sure I'll get some questions about that and I can answer those in more depth later. As I said, we've had a great start to what we've been trying to do with the pharmacy groups. And as I said, that's sort of been hit around the head a little recently, but we're rolling out TerryWhite Chemmart as I speak right now. And I'll talk to the major programs that we need to basically implement to improve the pharmacist's engagement with their customers. And that's our Connected Care Nurse team. Our Connected Care Nurse team are basically our asthma specialists, and they basically contact pharmacies to conduct training for staff and pharmacists, both in store, which is a little difficult in some states these days, but also virtually and by telephone. So we're both getting people requesting that we do these connected care activity days, but importantly, we are also proactively cold calling people that have bought WHEEZOs to suggest that a training session for their staff would be a good idea. To date, there's more than 700 pharmacy staff that were trained up until the end of July, and that continues to grow as we move. I've spoken about the Kevin Chan program, the RAMP program, the Remote Asthma Monitoring Program. It went live middle of June, and we currently have 24 relevant patients on that program. And we're capturing information. And as I said, it's important not just for Australia and a possible corporate health program that we'd like to play here, but it also may provide us with some insights into what the business model in the US looks like moving forward to support patients. I've spoken in the past about supplementing what CIPLA is doing in the field, and we have got an agreement with Hahn, who is a contracting sales force and nursing team, to basically target those pharmacies that are not on CIPLA's target list. They've been in full swing for the last few months. And as you can appreciate, there are certain things they can and can't do these days in certain states. And the CEO of Pharmacy for Less is being trained, or has been trained in WHEEZO, and given some support on what WHEEZO does, of course. And it's estimated that later this month, he'll be on the TV promoting WHEEZO to the viewers of the programs. Important to note from the Connected Care nursing team, I won't go into details, but you'll notice the number 5s and the large columns above number 5. The customer service and usefulness of the programs that our Connected Care nursing team have provided are extremely valued by pharmacy, and they see it as a crucial part of providing their staff with the competence to promote the device and app to their customers. So this continues to be a significant investment for us, an important initiative to make sure that we provide the pharmacists and their staff with the details and the resources they need to better engage with those customers that present with their ASTHMA every single month. Remembering that at least 12 discussions about asthma are had every single day across every pharmacy in Australia on average. Just to recap, we had a wonderful pharmacy conference in May this year, and it was very well received. We shared stands with CIPLA, and our head of Connect Care ran a training program for over 100 people at that particular conference. We had 12 new leads from independent pharmacies that were resulted from that, and it's resulted in 5 new stockists as a result of the programs that we provided. So you can see that we had Michael Clark there doing his stuff as well, and it was very well received by everyone that was there, when hopefully we can make more hay while the sun shines. Finally, as I said, it's been a tough time, but we've managed to deliver on most of the things that we said we will be doing in the first horizon of our development program. So the second horizon, which we're currently in, we've delivered on quite a number of these as well. And we will be providing information on the experiential program. We've got some preliminary results from that, which is very exciting. And we still are getting ready or readying ourselves for the launch in the UK. We're also in, as I said, extended discussions with potential remote patient monitoring partners in the US, and quite a number of potential clinical studies that we're hoping to run out of the UK and the US. Next year, we hope to expand into the EU, and importantly, the US marketplace in the back half of 2022. So I'm confident of where we're at. I'm comfortable with what we've achieved. It's always difficult in these periods to make predictions about anything moving forward, but we're still on track to hit what it is that we need to hit operationally. And we're learning as we go and getting ready for the big game. And the big game is in the UK, and it's in Europe, and it's in the US. So with that, I'll throw to the floor. And thank you very much for putting up with me for 20 minutes. Now I'll hand back to Nadine.
Easily done. Okay, let's get into a few of the questions that have been coming in. WHEEZO sales. So could you walk us through the trajectory for your expected sales, short, medium, long-term goals here in Australia?
Yep. Well, the WHEEZO sales for us, we've sold to CIPLA over 7,000 units of WHEEZO. And that's now within the pharmacy channel. And as I said, we're also launching our online presence with the Australian Patients Association, which represents the interests of about 1.2 million Australians. So that'll happen this quarter. Our objectives, the number that we need to hit to break even, we need to get to 72,000 subscribers at Australian prices to have the subscription of SaaS fund our organisation and put it in the black. We're expecting that to happen over the next few years. And it's difficult for me to give any real indication of what's happening, given that half of Australia is now locked down, which doesn't make things easier for us. And importantly, although Australia is an important marketplace from our perspective when it comes to design and execution, the game for us will be won in the UK and the US. That's where our efforts are going to be channeled. And that's why it's so important for us to be in a position to announce the necessary partnerships that we have to take advantage of the opportunities that those two marketplaces present to us.
Mm-hmm. And so it is, in terms of the US rollout, about the next announcement, the next catalyst may be on a partnership basis.
Yes, exactly right. So there are quite a number of possible announcements that will be forthcoming over the coming months. And as I said, the team is heavily engaged with potential partners that we need. I mean, when I first started with the organisation, I made it clear that we needed to have a bespoke model when it came to commercialisation. And what we want to in-house, mission critical competencies, which I think we've done. And importantly, outsource through a bespoke partnership model those areas that are necessary, but not things that we'd necessarily want to invest in. Sales forces, manufacturing, and the like. You know, starting a sales force in each country, I'd rather partner with somebody that knew what they were doing in that country, had the established relationships, and basically could provide the support that WHEEZO needs to be commercialised.
Here's one that's just come in. Have asthma support groups, are they part of the strategy?
Yes, they are. Yes, they are. So we are in discussions with the National Asthma Council. One of our advisors, Mark Levy's actually, who's based in the UK, sits on the GINA board. So he is a very, very useful resource, as you could imagine, when it comes to getting insights into what it is we do. So he's a board member of the Global Initiative for Asthma, which is a peak body that basically sets direction for the way that asthma is treated. And we're working with Asthma Australia and other institutions around the globe. So they are important, and we need to make sure that we understand what their objectives are, so that we can actually fit in with those. And as I said previously, that's why the GINA guidelines for self-management basically drive what it is we do as an organisation moving forward.
And what are the competing products? What is the competitive landscape like for WHEEZO, either here in Australasia or again overseas? You know,
Nadine, it's an interesting question. I mean, to me, the biggest competitor is complacency. We've got a situation where it's wonderful to be first to the marketplace, but people have never had access to something like this that provides them with information that we can provide patients with. And that those people being both healthcare professionals and also patients. So the mandate for us is to change behaviour, which takes time. So I'd suggest that that's probably the biggest competitor that we have, or obstacle. There is another Wheez device out there that's made by a Japanese company called Omron. It's different to ours in that it's called WheezScan, and it's binary. So it either says you've got Wheez or you don't have Wheez. It doesn't provide you with information about change in wheeze rates, which happens when you take things like inhaled steroids, respiratory medicines, or as, for instance, if you've got allergy-based asthma, as pollen count increases, it won't tell you that you're getting worse until you're worse. That's the big difference with ours, because what we do is provide the ability for that to be tracked and changes to be tracked, which gives it more clinical utility for what it is we need to do. So that's probably the biggest current competitor. And then there are the established diagnostics, spirometry, for instance, and we know how difficult that is for children to do, and we know it's almost nigh impossible for the elderly to do. So but they are established. I mean, spirometry was invented in 1846, so it's been around for a while, and doctors haven't had too much else in that time until we came along, which goes back to the original question, which is, or the original competitor, which is complacency and education.
Okay, just very quick question from me. believe you mentioned you've got your cost down to around $50 per WHEEZO unit. And you mentioned the point of sale price in Australia. Do you think you'll have to sell it cheaper in the US?
It's a different business model in the US. So because it's reimbursed, the models over in the US are basically, I'll call it product as a service model. So the doctor is provided devices like WHEEZO by a remote patient monitoring organization. They need to pay a nominal amount for the device because handing over anything in the US for free is illegal. And then basically we provide the back of shop services that allows that doctor to be able to monitor what's happening with their patient in the real world. So the rental that we would charge the doctor, the product as a service, is somewhere between 30 and 40 US dollars. That's a little different to the Australian marketplace where there's an upfront fee for the device and then a lower SaaS monthly fee as well. So the answer to your question is that patient's probably worth around 5 times what an Aussie patient's worth, but the model's very different, if that makes sense.
Okay, good. Well, thank you so much for joining us, Marie-Michel. We really appreciate it. And it was a good presentation. Thank you.
Fantastic. Thanks, Nadine. Bye. Thanks, everyone.